And Sahani sir. Good evening, good afternoon, and good morning. This is the 1295th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. AVI Sharma. Let us begin the session with 1 minute silent prayer. Thank you all. Just 5 days away from 1,300 days of continuous webinar conducted by International Forum for Promoting Homeopathy. As you all know, we are having 3 sessions every day from 7 to 8, the Hindi session, and 8 to 9 international session in English, and 9 to 10, we have our local language session in Malayalam. So all these things are being uploaded every day now, and you can see all those things in our YouTube session. And today, our guest is Dr. AVI Sharma, who has completed his MD in homeopathy and later PhD in homeopathy. He is a senior homeopathy consultant at Hanuman Homeopathy Clinic, New Delhi. And he is also a guest lecturer, Department of Anatomy, Nehru Homeopathic Medical College and Hospital, Delhi University, New Delhi. He has presented some 2 sessions in English and 2 other sessions in Hindi session, Hindi webinars also. So today, Dr. AVI Sharma will be discussing about tonsillitis, a clinical aspect with homeopathic treatment. As you all know that one of the commonest problem children suffer nowadays is tonsillitis, and some of the children are not having tonsil because they underwent treatment for allopathic system, and then they undertook surgery and they have removed the tonsil. This is one of the tragedy that happened from other side. So we as homeopaths have a very good system to prove that no surgery is required to, or no need to remove the tonsil. So Dr. AVI Sharma will be explaining everything about it. And let us proudly welcome a guest of the day, Dr. AVI Sharma. Welcome.
Thank you so much, sir. This sort of introduction, I'm not used to this, but still, thank you very much. And let me start with like commenting on whatever I was actually like listening to from all the stalwarts who were like talking before me. And like Dr. SM Singh said, that if a homeopathic physician can actually manage a case in acuteness, he is out to be amongst the best, because acute conditions are that are very difficult to manage. First, because the patient has actually like come to you in urgency, and secondly, there's a very very wrong notion regarding homeopathy, that homeopathy doesn't work in acute conditions and it takes a pretty long time. So I have chosen this topic, tonsillitis, because it is one of the most common problem that a child would suffer from. And secondly, it is also very easy to manage in homeopathy, provided you need to know, you should know what we are talking about and what we are trying to manage, and also the symptoms and how to take those symptoms out of the case. So let me start with the topic, tonsillitis, clinical aspects with homeopathic treatment. So when we are talking about tonsillitis, we ought to know what tonsils are. You generally tend to find like various prescriptions on which it's written that a patient is suffering from tonsils. And whenever I see such a prescription, I tend to tell all the students or all the young homeopaths who are visiting my clinic that you need to make this prescription correct, because this prescription is actually going to go to other doctors, and then this prescription, as per this prescription, an impression is being formed of what sort of practice you're doing. So starting with the tonsillitis, so let us start with knowing what tonsils are. What are tonsils? So tonsils are basically the lymphoid organs of our body. To be precise, they are the secondary lymphoid organs The primary being the thymus and the bone marrow. So when we are talking about the lymphoid organs, they ought to have some relationship with the limbs, and this lymph is actually related to related in giving us the immunity. So when we are talking about the tonsillitis, these tonsillitis are actually, the tonsils, these tonsils are actually present in our body in a way that they are forming a ring all around our aerodigestive tract. Now, what is this aerodigestive tract? The basic pharynx. So when we are talking about the pharynx, we'll need to know the three parts of the pharynx. The first part of the pharynx is the nasopharynx. Second is the oropharynx, and lastly the larynx. Now these tonsils, this is when we are talking about tonsils, there's not just one tonsil, there are different groups of tonsils that are present. So starting from the group which is present on the top, which is known as nasopharyngeal tonsils or the adenoids. Below this is a pair of tonsils which are known as tubal tonsils. Next to that are the palatine tonsils. They are the main tonsils that are present, and inflammation of this tonsil, this group of tonsil, is generally termed as tonsillitis. And on the roof of, on the tongue is present the lingual tonsils. Like you can see, in the pharynx, the tonsils are present in a way that they are forming a ring. And this ring is known as Waldear's tonsillar ring. The main function of the Waldear tonsillar rings is to provide a network, and with this network, it prevents the entry of all the harmful microorganisms from the exterior environment to enter the inner body. So when we talk about the tonsils, we'll need to know the development of the tonsils as well. So generally, like Dr. Saab said, that in today's scenario, parents, they tend to opt for tonsillectomy because they think that the tonsils can never be treated. But it's a notion that we need to address, because tonsils are generally found in patients, in people who have reached the puberty. After puberty, the tonsils, they itself go through atrophy, and the patient can never have tonsils, or are very less likely to have tonsils in the rest of the life. So when we talk about the tonsils, the most common tonsils that happen are the palatine tonsils. And the palatine tonsils in the developmental stage are largest at the time of puberty. And after that, they gradually undergo atrophy. And the adenoids, which we have already termed the nasopharyngeal tonsils, they set in until the age of 5, and after the age of 7, they again get atrophied as the adulthood comes. You tend to have patients in your clinic who will come to you and who will say that, okay, Dr. Saab, my son or my daughter is suffering from adenoids, and can you tell me, can this be managed? And I actually happened to listen to a doctor, a homeopathic stalwart, and in his seminar, he told me when I was doing my MD that you need to know the basic knowledge of medicine. If in case a person is coming to you at the age of 10 and he's saying that the adenoids are actually causing trouble to my son or my daughter, you need to know that this adenoid will itself recede or regress. You just need to focus on the basic symptomology or the basic totality of the patient. So when we have talked about the basic development of the tonsils, I would want to put the emphasis on the palatine tonsils, the most commonly referred tonsils, which are also known as the phaseal tonsils. Why they are known as phaseal tonsils? Me being the student of anatomy, I tend to like focus a little bit, I'm a bit partial towards anatomy. So I tend to focus a little bit on anatomical aspect. So when we talk about the palatine tonsils are present on the anterior and the posterior pillar of the fossus. And where is this fossus present? It is actually present in the oropharynx. The nasopharynx will have the adenoids, and the oropharynx will have an anterior and a posterior pillar, and on these both pillars are present the palatine tonsils. Now, when we know the location of the palatine tonsils, we'll need to know what this palatine tonsils is made up of and why is this so important in our body. So the palatine tonsil is a highly vascular organ, and this palatine tonsil, it forms a mucosa associated lymphoid tissue, which is known as mole tissue, when it is present and where it is present, and it is present on the entrance of the upper respiratory and GI tract, or basically the oropharynx. So when we talk about the palatine tonsils will basically have two surfaces. One surface which will actually be directed towards the cavity, the buccal cavity, and one surface that will be actually like that will be facing the floor on which it is resting on. Now this cavity, the face which is actually facing the cavity, this face is the medial surface, and this medial surface will have 15 to 20 crypts. Crypts are nothing but they are just indentations in the medial surface of the palatine tonsils. And these crypts, they are actually present in a manner so that they will increase the surface area of the tonsillar gland. Why is the surface area increased? Because as much as the surface area is, the more microorganisms that can harm our body can be actually enclosed and can be actually prevented to enter our body. Now, when we talk about the crypts, we'll need to know one basic thing, that these crypts are divided into two types. First is the primary crypt. The primary crypt is the primary indentation that is happening on the medial surface. And when this primary crypt divides further, they are known as secondary crypts. These primary and these secondary crypts, they are actually lined by the stratified, they are actually being lined by the stratified squamous non-columnar epithelium, and it is because of these crypts the bacteria and the viruses are actually getting lodged in them. Now, when we talk about the lateral surface has its own importance. Now, the lateral surface of the palatine tonsil has a fibrous capsule, and this fibrous capsule is present on the roof, or on the floor of the tonsil. But the floor of the tonsil and the lateral surface, which itself is being covered by the fibrous capsule, will have a potential space, and this space is known as the retroareolar space. Why is this space important? This space is actually important so that in case of inflammation, the tonsils have a potential space on which it can actually go further in. And in case of very recurrent tonsillar affections, this space is actually being filled by a pus, and this condition of the retroareolar space being filled by the pus is known as quinsy. This is also very, very important part when we talk about the complications of the tonsils, specifically the palatine tonsils. The tonsillar crypts, they are actually made up of four main components. First is the reticular crypt epithelium. Second is the extrafollicular area. Third is the managed zone of lymphoid follicles. And lastly, the follicular germinal centers. And the most commonly exposed part of the crypt is the tonsillar epithelium, the reticular epithelium. So once we know about the crypts, I would actually want to show you how this crypt is how the crypt is actually seen in case of microscopic examination. So this basically is the crypt which is present on the medial surface of the palatine tonsil. And once these crypts, the 15 to 20 such crypts, they are actually present, they actually do what? They increase the surface area. Anatomical presentation of tonsils, once we see anatomical specimen, so you can actually see on both the lateral aspect is the palatine tonsil present. This is the root of the tongue. The lingual tonsils are present over here. Rest all other structures you can actually see the anatomical representation. Coming to the basic function of the tonsils. What are these tonsils made for? These tonsils are basically the guard of your body, which are protecting your body from all the unwanted microorganisms that would want to enter the inner environment and actually cause various diseases. So the first thing is they are actually protecting us from the unwanted microorganisms. Second thing is, because of this repeated infection, these tonsillar cells, they are actually adapting themselves to form all sorts of antibodies. All the 5 major antibodies that are present in our body is being formed by the tonsils. Coming to very specific antigens that these tonsils that can form, because of repeated specific infections that a person is having, they can actually form specific antigens for the repeated infection themselves as well. The function basically is the immunity. So there's a very common statement that my father tells all the patients who have actually come after tonsillectomy. I would actually discuss this in the later stage. So let us talk about tonsillitis per se. So whenever we talk about itis, basically means the inflammation of the tonsils. Tonsillitis in this condition means inflammation of the palatine tonsils. Generally, when we refer to tonsillitis, we are referring to inflammation of the palatine tonsils. So the inflammation of the tonsils is known as tonsillitis. And in the tonsils, this inflammation would be seen as edema, erythema, and pain. These are the signs that we are going to see in the tonsils. And because of this erythema and edema, what all the symptoms that we are going to get in the patients are the symptoms of the tonsillitis. So tonsillitis basically means inflammation of the palatine tonsils. Now this inflammation can be categorized in 2 conditions. First is acute, second is chronic. Acute infection, acute tonsillitis generally happens majorly because of virus, and bacterial infection is the second most common cause of acute tonsillitis. When we talk about tonsillitis, the symptoms that we associate with acute tonsillitis or in general tonsillitis is sore throat, fever, enlargement of the tonsils, trouble in swallowing, and enlargement of the lymph nodes in later chronic stages. Now, the complication include peritonsillar abscess, which is quinsy. And what is this quinsy? It basically means presence of abscess on the lateral side of the tonsils in the retroareolar space, which is present in between the lateral side and the bed of the tonsils. Over here in the slide, you can actually see the abscess being present and the bulge it is forming because of the abscess. The causes of the tonsils, like I've told you, majorly the tonsils are happening because of viral infection. 40 to 60% of patients who are going to come to your clinic are going to come with viral infection. And the most common virus because of which this tonsils are happening is the Epstein-Barr virus, EBV. Coming to the bacterial infection. Now, this bacterial infection in the tonsillitis is generally being done by the group A streptococcus, and tonsillitis because of group A streptococcus is known as strep throat. If in case in a prescription someone has written strep throat, this means bacterial infection group A streptococcal in the palatine tonsils. It is, and there are other very rare bacteria that can actually do tonsillitis, which include Neisseria gonorrhea, Corynebacterium diphtheria, or Haemophilus influenza. The signs and symptoms that come with viral infection and bacterial infection are identical, but there is a very slight change. So the infection, if in case it is viral, it will actually happen after a major time, which will take approximately 4 to 5 days. In that 4 to 5 days, a general viral complication, the general complication that happen because of viral infection like runny nose, cough, hoarseness, etc. can happen in the body. After 4 to 5 days, if in case the viral infection is not settled, then comes the main associated symptoms of the tonsillitis, which include painful swallowing, malaise, high-grade temperature, and sometimes other inflammatory condition of the lymph nodes. Now, when we talk about the bacterial infection, this bacterial infection is very precise because this bacterial infection tend to give you exudate. And exudate is what? Because of the edema and because of the erythema, these bacteria, they actually give on an exudate, which can actually vary depending upon the bacteria the person is suffering from. The exudate can either be white, or it can be yellow, or it can be gray. Yellow generally happens because of group A streptococcal bacteria. When we've actually discussed all these things, there are very small things that we need to put emphasis on, and one being the petechia that happens in case of bacterial tonsillitis. Sometimes in cases of children, it is very difficult to inspect the patient, and it is very difficult to actually ask the patient to open its mouth and show us the affected part. But if in case we can actually see the petechia that are present on the roof of the palate, we can actually determine that the patient is suffering from bacterial tonsillitis. Coming to the investigation part, so the tonsillitis, the tonsillar size is actually divided in various grades, and there are 5 grades that we talk about. Grade 0 is when the tonsils are normal, or after the case of tonsillectomy, when we do not tend to see the tonsils. Grade 1 means the tonsils, they occupy 25% or less oropharynx. Grade 2 means when the tonsils are actually occupying less than 50% but more than 25%. Grade 3 is when the tonsils are occupying less than 75 but more than 25%. And grade 5 is when the midline of the tonsils are meeting each other, thus occluding all of the oropharynx. There are other different criteria that we tend to follow when we want to differentiate the bacterial and the viral tonsillitis. One of them being the Centaur criteria. So basically, there are 4 key criteria that are present. First is the tonsillar exudate. Exudate means when we see a exudate on the tonsils, when we see a fixed color on the tonsils. Second is the tender anterior cervical lymphadenopathy. Third is fever or history of fever. 4 is absence of cough. A score of 3 or more is highly suggestive of bacterial infection, and a score of 2 or less is suggestive of the bacterial infection is not there. The tonsils generally can be viral. Second thing is the fever pain criteria. Now, the fever pain criteria will give us 5 points, and if a patient is suffering from any of these points, we need to give 1 point. And depending upon the score, we tend to see what the symptoms are and what sort of tonsillitis the person is suffering from. So the first is the fever during or previous to the 24 hours, the purulence or the exudate, the pus on the tonsils, the attended rapidity of the tonsillitis within 3 days after onset of the symptoms, severe inflamed tonsils, and fifth is the no cough or coryza. Now, each of these 5 points will be given 1 point, and depending upon the score, if the score is 0 to 1, it is suggestive of 13 to 18% chances of streptococcal infection. 2 to 3 point means 40% chances of streptococcal infection, and 4 to 5 suggests that the chances are very high, and generally it is the streptococcal infection that we are talking about. There are other criterias also, like the gas criteria, which is actually like one of the most assessed and assertive criteria when we are talking about knowing the patient is if he's suffering from streptococcal tonsillitis or not. Coming to the homeopathic aspect and why this tonsillitis is so important for us. See, whenever we are talking about any acute condition, a patient is going to come to you, and a patient is going to come to you with an idea that I need immediate relief. And trust me on this, that homeopathy is a branch that will give that immediate relief, provided we tend to find the exact symptom that the person is suffering from and how this symptom is being formed. In the previous session, I was actually like listening, and there was this one thing that was actually mentioned, the causative factor. Why is the person suffering from this? It can actually be because of spring season anomaly. It can be actually because of exposure to cold. It can be because of whatever the person is eating. It can generally be because of viral infection, the seasonal infection, or someone in the family is suffering from some trouble. But because the person has actually like got this infection or the bacteria the person has got, there will be a very precise and characteristic symptom that the person will show us. This precise characteristic of the symptoms given with the cause of the disease and the amelioration and the aggravation of the symptoms will give us a condition, will give us a totality, and will give us a similitude. I've always tend to believe that if we get the precise symptoms, even if, see, I basically practice on totality, but in cases of acute infections, sometimes we cannot get the totality. And if in this case, we are practicing on therapeutics, but intelligent therapeutics, not blindly closing our eyes and just giving n number of random medicines. No, very precise, very therapeutic medicine, depending upon the aggravation, the amelioration, and the cause of the disease, we tend to find results in the patients. Generally, there are a set of medicines that you think of when a person is suffering from tonsillitis. It starts from aconite. It ends at, I don't know, Phytolacca or Merck group and all the other groups. So that is why I've not added the therapeutic part, because therapeutics, each and every medicine can treat tonsils. Each and every medicine has the capacity, has the tendency to manage a case of tonsillitis. But if in case we would want to like put emphasis on very few, very particular medicines about tonsillitis, First is the hypersulf that you always tend to think of. Second is dalka mara. If in case the tonsils that is happening as of now, the days are very hot, the nights are very chilly, and people have started eating ice creams and all. So you tend to get dalka mara patients in this season. Then you can actually have phytolacca. You can actually give patients ignitia in cases when there are all sort of symptoms that are present, but none of the symptoms actually make sense because you generally tend to find contradictions in ignitia. The Merck group, specifically the Merck iode flavus and Merck iode rubrum, I've got excellent results from Merck iode flavus and Merck iode rubrum, depending upon the Merck group and the very specific which side tonsils are actually getting affected. The tuberculinum, lycopodium, bacillinum, syphilinum, all these medicines give excellent results, provided you get like the basic thing, the basic gist of the symptoms that you actually like form. And if in case, sorry, I don't have that much matter today because I actually am like someplace else. I'm not at my place. So if in case anybody has any doubt or any discussion, they can actually ask me regarding tonsillitis. Any question, any doubt, if you would want to ask, I would. It would be highly appreciated. So let me.
Yes, it's really a very good session. I hope that you could present this. We hope that
Yeah,
we
please,
present some of.
I actually got to know about this session today in the morning, and I'm on vacation as of now. So I'm joining you from a very interior forest area of Uttarakhand. So I'm really sorry if the connection or the internet connection was not that good.
No. Everything was fine. Everything was fine. Your presentation was excellent. The content was excellent, and your findings are also excellent. Because, frankly speaking, this is one of the area where homeopathic doctors can do lot of work and lot of wonders. And as we all know that if a person click in the right position. That is, if a person is able to manage the acute case in a good way, definitely he will be a very good position according to the people around him. And naturally, the homeopathy will be the winner. And this is
I would want to add one thing. I had forgotten about this. Like Dr. Saab mentioned in the beginning, the biggest blunder you can do in a child, a 3 or 4-year-old child who's suffering from recurrent tonsillitis, is getting tonsillectomy done.
yes.
Tonsils basically are the guards of your body. They're actually present here for a reason. They're actually present here so that a major infection cannot infiltrate inside your body. And what will happen if there are two guards that are standing in front of your home, and a person comes and every day he beats that guard, and that guard will actually come and complain to you that, oh doctor, see sir, this person has come to my place and he's beating me every day. You tend to give him even more better weapons. Okay, you defend yourself pretty well then. You do not ask the guard to just go. If in case you're asking the guard to like leave that post, the person who's actually doing whatever would enter your room and then he would start beating you.
Yes, definitely. This is what we have to look, because nowadays, I usually it is the time of specialization. And most of the people definitely go away, even for a common cold. They go. They first visit the as far as children are concerned, they really visit the pediatrician, and they used to give antibiotic from the very beginning itself. So, if it being a viral infection, there is no use of these antibiotic can do anything good in that condition, but it will do more damage than good. Then what we have to do is that if the patient come to us in the very first time itself, definitely we can manage the acute illness without further complication. Actually, when a person you take undertook this antibiotic from the very beginning, naturally his resistance will go down. And when the patient get another infection in a short time, naturally the tonsil size becoming enlarging day by day. And if the patient get recurrent tonsillitis, naturally the size of the tonsil will be much bigger than what it used to be. And as we all know that when a fever comes in, naturally as a protective measure, tonsil will get enlarged. And once the disease subsides, the tonsil will also go to the normal size. But in case of use of this kind of antibiotic and so many medicines, it never goes down to the original state. And as a result, it becomes a organ of infection.
Also, one more thing, sir. One
And then
actually
that
seen in cases is that the parents, they actually want easement of their own self. They don't want to get their job or their work shouldn't get hindered because the child is suffering. It's
yes,
because of this simple thing that a person, a parent would go to a pediatrician and he would be very happy to give n number of antibiotics, and not just antibiotics. I'm actually seeing steroids being used in private practice for children who are less than 2 years of age. Steroids for
yes,
tonsil.
exactly.
and and it's just that when you talk to the person ki, okay, why are you giving this? You are a very well sorted and very educated person, you know what these things will do to the person, the child in this case. Why are you giving this? They say, Doctor Saab, the child had fever, we cannot manage the child if he's crying. I am ready to give whatever, because in the morning I'll have to wake up and I'll go and need to go to my clinic, I'm sorry, the office. This is what you get from
Yes,
parents. These are
yes,
the answers that you get. So rather than just giving medicines to the patient, I tend to focus on the basic structural differentiation and the basic counseling that the parent would need. You are giving the medicines as of now, but in the future, whatever the consequences are going to happen, you'll have to bear that.
yes,
Once patient who has actually like been apna objective to tonsillectomy, if the patient is going to like suffer from a very severe disorder, n number of disorders can happen after tonsillectomy.
yes,
And
yes, yes. I shall. Still remember a case of a child who was just completed 3.5 years, underwent 3 surgeries because this child was having recurrent fever, and as a result, the pediatrician directed the child to. They were living in the Gulf countries, and they went to the ENT specialist, and where they undertook surgery for the tonsil, and they removed the tonsils, and thereafter the child has started recurrent ear infection, and they they made another surgery on the ear, and thereafter the child has problem in the nasal problem, and as a result they corrected the nasal surgery. So all these surgeries were done, but the child is suffering a lot. And when they consulted me, I just give an advice after giving the medicine: don't give ice cream all to this child. Then they told me that, doctor, we used to give this child from the very beginning itself, and no doctor advised us not to stop this. This is what is going on. They are not interfering with the cause of the disease. They just do just like a electrician doing his work, or a mechanic doing his car service. This is what is happening nowadays due to the over specialization.
yesterday itself, I got a patient who's suffering from a small kid who was suffering from tonsillitis, and I was actually asking questions regarding tonsillitis from the patient, from the mother, and she told me, Doctor Saab, mind you, this child is 1.5 years old. Doctor Saab, we tend to give him a little bit of coffee because it soothes the tonsils. Like, are you mad? You're giving a 1.5-year-old kid coffee. What sort of coffee you're giving? Whatever coffee that we have, Dr. Saab, I tend to give this. You're not supposed to give coffee to kids. You know this. This is the basic thing. I'm 34-year-old. I've never had coffee in my life. And you're giving 1.5, 2-year-old kid coffee. So this is the basic negligence that we are getting from parents. They just want management. They just want relief from the symptoms, and they can do anything provided the sleep shouldn't be hindered. So whenever a person is coming to you, if in case it is because of acute tonsillitis, first thing, I skip the child, I'll skip the patient, and I'll talk directly to the parents. You see, this is the thing. This will take this much time, and maybe tonight the kid would be awake, because obviously I'm actually like skipping all the antibiotics and all these anti-inflammatory drugs. So quite possible the fever would increase, but don't get affected. I'm on call. If in case you want my help, just call me. So in case of clinical management part, I think it's up to the doctor as well, that the doctor has to be available. That I've said.
Definitely, the doctor need to look into all aspects of the case, and then not only giving medicine. Of course, you can give medicine. In between, what you have to do is just give the right advices. Usually, we see that some people used to take bath every day, even when the child is in fever, but the child may disagree that no, I don't want to bath, but still they force us that it is better to have this cold bath for your head. But this is what we need to control there. We should not allow the child to, if the patient is a chilly person, you never allow the child to have a head bath. And if the patient is hot and the patient prefers the cold bath or hot bath, we can allow him. In those conditions, as we know that if a person is a force-sort patient, he likes to have bath, a cold bath, and he can have bath, there will not be any problem. But if the patient is a rustos person, definitely his condition will worsen, and the patient may go into the secondary stage of this tonsillitis into bronchitis and pneumonia like condition. So we can avoid the complication by advising by giving right advice. Am I right, doctor?
Yes, sir. And one more thing, like you all are stalwarts, sir. You all have actually like practiced like way many years than me. But there are few students who have actually joined, and one of them has actually asked a question. So when it comes to acute diseases, every young homeopath wants to actually manage cases of cancer. From day one, he wants I should get patients from who's suffering from cancer, from cirrhosis, from jaundice, from X, Y, Z, whatever. But what I tend to tell all these young homeopaths, including me, my father has told me this, that first make an emphasis on making it a point that a person, if in case he's suffering from acute disorder, that he should not leave your clinic without relief. You should make it a point that the acute disorders, because if in case a person who's suffering from any acute disorder, in this case tonsillitis, if he's getting better with your medicines, he will put faith in you regarding the chronic medicines as well. Okay, Dr. Saab had given me medicine and I'm feeling I was much better. Within a day or two, I think I should actually visit him for these other complaint as well. So these acute symptoms, acute conditions are the building blocks to make your practice even more brighter. That's what I've actually like felt in my whatever, like the small amount that I've pursued clinical practice in.
Definitely, these are the things one need to look into and need to do also. I think this is the time for discussion. Those who want to participate in the discussion can raise your hand, we will allow you to unmute yourself and you can speak. And I invite Sri Ahmad Hassan to speak.
Thank you, sir. Dr. Sharma ji, it is very educative webinar dealing with anatomy and pathological review. And especially you mentioned about the group of Streptococcus. And it is famous that the Streptococcus uh, lick the heart and bite the joints. So this Streptococcus infection of um, tonsils also give problem to the heart and joints. Thank you very much, sir. Always stay blessed.
Thank you very much, sir.
The complications need to be avoided. And if a person continue with the homeopathic treatment, definitely we can end up the case in a short time without any complication.
So
We have seen several times that there are patients who are supposed to undertook these kind of surgeries were prevented with homeopathic medicine, or we were able to avoid this kind of surgeries.
My younger brother, he's pursuing his MS, sir. And he has got a very bad habit of eating ice creams and eating chilies and whatnot. And this doctor himself is actually a very, very avid tonsillitis patient. And he doesn't get like normal tonsillitis. He get follicular tonsillitis, like pura proper tonsillitis. And this MS doctor, whenever his seniors, his consultants, they tell him, okay, you are 28, 27 years old, opt for a surgery, get this thing removed. Why are you why are you suffering? But he himself says, no, sir. So this is the thing, this is the sort of like a base that we want, that we need in our society, so that a person is educated enough, even if in case he has whatever the pursuing factors may be, he has an ability to defend himself. Ki, no, I know what this thing is. I know this thing is because of me. I've had like a bucket of ice cream in the evening, and I know the sore throat will happen. But if in case I do have medicines and within a day or two I can get rid of whatever the follicles are, the follicles, and then his like the consultants, they see Acha, within 2 days how these follicles have actually disappeared. He said homeopathic medicine, sir. The most consultants are actually asking for homeopathic medicines from a MS surgeon banda. So this is the sort of thing that we have. So I can actually say this with my whole heart and chest, that homeopathy is the best thing that can happen in case of acute infections and chronic as well. But in case of acute infections, you get results just like this.
Nowadays, exactly. Nowadays, we are getting lot of cases maltreated by the other system doctors from other side, and as you rightly point out, some of the medicines that mentioned. Of course, we can add some more medicines into that list because the personal identity, that is the individual medicine. Homeopathy, as all of us know, that is an individual medicine. So, if the person, for example, coming to a fever and have no thirst, and is chilly and is very dull, definitely we can think of a pulsatilla. If the patient is coming with extreme redness, sudden pain, sudden intense pain, and the body, the child is felt feeling fever and went up to the bed without much playing, and then we can think of a belladonna. Whether it is a case of tonsillitis, it is a case of viral fever, whatever may be the disease. Definitely, that is the way homeopathic doctors. Of course, the other side is that if the patient is having fever from taking cold drinks, then we can think of some remedies. For example, pulsat, this Rustox. Then, if the patient is having tonsillitis from getting oil, fatty food, then we can think of pulsatilla. If the person is having fever and tonsillitis from eating ice cream, but he is chilly and taking, or he can take only hot water a little bit, then we can think of arsenic, like that. So many medicines we can use individually, and that will work just like a magic. within 24 hours to 24 to 48 hours, we will get the result. This is the beauty of homeopathy.
So basic reason why I had not like put in the name of the medicines was because I wanted to discuss the medicines from like the stalwarts that are present over here, and whatever 5 medicines that I could have actually like mentioned in case of therapeutics, I've already told the name, but it's better that I get like few bit of information for myself. Like
Yes.
Dr. Savitz told me about pulsatilla. I generally do not prescribe pulsatilla in patients who are suffering from tonsillitis. I just got to know about this. This is how we're going to like proceed.
Yes. Now Dr. Manoj can add some more points to this management of acute tonsillitis with homeopathy.
Thank you, Dr. Tanesh and Dr. AVI SHARMA. It's a very important topic, even though it looks like quite simple. A lot of persons are suffering from this tonsillitis. And what was the method? The majority was adopted was tonsillectomy. And recently they recognized that it is not at all a right method. Even though each and every time they claim they did conducted a lot of studies, so-called scientific studies. Then again, they had to change the strategy. But what homeopathy is doing is, for the last 220 years, the same thing. But it's more important is the presence of miasms. So to prevent this recurrence, you always need some anti-miasmatic medicine. Without this anti-miasmatic medicine, we can't cure the case. Then as Dr. Tanesh mentioned, the most important thing is the exciting cause and the maintaining cause. The physician must be well aware of all these things. Just like after chilling the stomach, the advice is Dr. Samuel Hahnemann, you take arsenic album for chilling the stomach after taking cold drinks. Just like the conditions from exposure heat of sun, belladonna, then Epis is also another medicine. So it's a totally a practical system of medicine. What happened? What is the cause of the disease? You address the cause. Through the similar medicines, you can cure. That is the most simple way and safe way of homeopathic medicines. Moreover, the medicines are well proven. And also, giving in the minimum dose dynamized form, they will not harm the child or the patient. That's the most wonderful thing. I think we must capitalize on these areas, the strength of homeopathy. Then we have to become more specialists. We need what does the society seeking specialist? We need certain persons who have got some expertise in all the subjects. Definitely, homeopathy will improve. Thank you.
Thank you very much, sir.
Yes.
That's it, sir. Like Dr. Manoj actually like put it in like a very specific words. Like we need to know, we need to put emphasis on knowing the maintaining cause, the exciting cause. We need to know why this thing has actually occurred. Nobody is actually putting emphasis like the due importance of the symptoms and how to get those symptoms. Nobody is getting up now, putting up the efforts into that. And that is where I think we are lacking. Everybody in this present day, like if in case 10 students are coming to me, they just come to me to know the name of the medicine. Sir, tonsillitis, which medicine?
No, that's not the way. Exactly.
Yes, sir. They actually come with like notebooks. Okay, sir is giving this medicine for this medicine is for this. Doesn't work like that. A student of mine has actually like put a question: in case of chronic tonsillitis, can I give Sorinum? In the chat, I've actually read it. Shivank, doesn't work like that. If in case a person is Sorinum will definitely help him. But if in case he's not Sorinum, doesn't work. It won't work.
This is a typical example of what Hahnemann mentioned about 3 mistakes committed by a physician during treatment of chronic disease. One is this wrong choice of medicine. He says that because of the lack of earnestness, inexactness, and love of ease. These are the 3 causes identified and mentioned by Dr. Samuel Hahnemann in chronic disease. This very easy to, they want to know which is the medicine. What about the patient? What are his symptoms? Nobody is bothering.
Yes.
They need certain clues. If there is no clue, they will not attend.
Sir,
That's
it,
all happening.
like my father says this, it's very easy to become a BHMS doctor. It's very difficult to become a homeopath.
Yeah,
Exactly.
exactly. This is this is what we have also noted in the beginning. After completing the course, we don't know where to move on, how to move on. Then, fortunately or unfortunately, we get some seniors, and they sometimes in those days there were no such webinars or no such sessions going on. Simply, we have to. So we just like your student asked me, doctor, what can be given? Definitely, no doctor will say that you can give this medicine or that medicine. But you go and read this material medical textbook and you prescribe like that. But only after we were exposed to some of the presentation by seniors in our organization some 30 years back, then only we started knowing that how to prescribe a single remedy and how to move with the single remedy and how what are the things you need to give, what are the things you need to observe, what are the kind of advices you need to give the patient. And then only you become a complete doctor. Otherwise, you just like a pharmacist. A homeopathic doctor never be a pharmacist, but of course he is a part of a pharmacist. He can do the duty of a pharmacist, but in between he is a dietitian. He is a natural observer. He is just like a parent. Like he must be. Sometimes some people believe that your doctor is a god. Yes, definitely. You can become a god in the mind of the patient or the person around you, patients around you, if you do 100% sincerity in treating the acute illness or chronic disease. But definitely acute diseases will give fame and money rather than the chronic disease. Of course, chronic disease will give you satisfaction and your perfection. Am I right, Dr. Avi?
Yes, sir. Basically, whenever I sit at my clinic and like if students are visiting me, I tell them one thing and one thing only. That ego, keep your ego in your pocket, and it's better to you start practicing for the betterment of the patient. If in case you see that the patient is not getting better with your medicines, ask him to go to a good doctor. If you cannot actually like if you cannot make the person feel better, it's better within the time. आप उसका समय बर्बाद मत कीजिए. Do not waste the person's time. Send him to a better place. कि okay, I know a doctor who is much more qualified in this particular aspect, and it's better you visit him. And learn from anywhere and everywhere. There's Dr. Vittal in Punjab who practices homeopathy. And his son was my junior in BHMS. And I visited him. He told me this one thing, that always keep your hand like this. If in case you are able to learn something, just pick it up and make it yours. If in case this thing is not useful to you, throw it away. But keep your hand like this. Keep on absorbing whatever you can. If a student from first year can tell me something better, something good that is good for me, I would definitely want to learn that.
Yes, yes, exactly. This is what all of us has to do. That whether a homeopathy doctor never become a perfect person unless he reads, and unless, till your death you can study from juniors also. There is no problem. And now I invite Dr. Masrina from Malaysia to say vote of thanks to this session as the time is about to finish.
Okay, thank you, Dr. Dinesh. Thank you, Dr. AVI Sharma, for a very interesting topic. As you know, tonsillitis cases in Malaysia, there's a lot of it, and I think really appreciate your sharing on the treatment. We look forward to having you again in the future, perhaps sharing more interesting cases. So on behalf of IFPH, I would like to extend our utmost appreciation for your presence today in presenting this topic. Thank you once again.
Thank you, ma'am. And hopefully next time I'll be better dressed and my hair would be in a better shape.
No problem. You are as smart as ever. And thank you, Dr. Masrina, for your tomorrow we will having another session at the same time. You can use the same link and you can see the videos of the today's presentation by tomorrow itself at YouTube. by evening. And tomorrow, the session will be concept in fever. Another session, just like Dr. AVI Sharma here made here, homeopathic perspective, concepts in a fever, homeopathic perspective. So all of you are invited to join the session tomorrow at the same time. With that, goodbye. Thank you. Thank you, Dr. AVI.
Thank you, sir. Thank you.
Oh, and it is out to Dr. Mariamma John to moderate our next session in Malayalam.
നന്ദി ധനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1295 പ്രതിദിന സൂം വെബിനാറിലേക്ക് എല്ലാവരെയും സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. ഇന്ന് നമ്മളുടെ ക്ലാസ് ആരംഭിക്കുന്നതിന് മുൻപ്